Mr. President, members, guests, ladies and gentlemen, the chill winds of a global recession, allied to banking difficulties and the particular issues that face our exchequer, are sweeping through the country. Never before have we experienced a decline in economic circumstances as steep as we are in now. We are in crisis. We have seen how adjustments, to put it mildly, have been made right across the economy, and how the recession has impacted employment, business, banking, trade, politics, and life in general. While recognising both the economic and fiscal imperatives, the latest attack by the Health Service Executive on the Health Service through a campaign of cutbacks doesn't seem to have any structure or rationale behind it. Even in times of plenty, the Health Service struggled to provide adequately for those who needed its facilities. Our overriding concern now must be that in taking tough economic decisions, we do not find ourselves in a situation where we have a public health service that has effectively been dismantled. We must make sure that we are not left incapable of caring for the health needs of our citizens. The cuts of the 1980s caused great hardship to vulnerable people for a long time. We know that tough decisions need to be taken, but decisions need to be made for the right reasons. Not because they were on a previous wish list, which current circumstances give the opportunity to implement, but rather because it is the right thing to do in order to deliver better services to the patient. The medical profession wants to be part of the solution to our present difficulties, but does not have the confidence that the HSE sees it that way. The public are reeling from the effects of unemployment, reduced pay, uncertain futures, increased taxes and diminishing pensions. While many have had to accept changes in the standards of living, we should still be in a position, as a responsible and civilised society, to deliver a good health service that people have confidence in. A roof over our heads, food, water, healthcare and education are the staples required for those who live in society. The state has a duty and obligation to ensure that each of these basic requirements are provided for every citizen. The public service, most especially the health service, has always been an easy target for commentators to talk about black holes, inefficiencies and waste. We in the IMO have often been rightly critical of the lack of funding and the reduction in resource allocation to the health service. However, that has never been an obstacle to our feeling of pride in it, and most particularly the pride in each and every doctor working in the front line delivering to the very best of their ability to patients. While change is important, it is anathema to us to hear talk about the indiscriminate rationing of health services. Let us be clear about what rationing is. In effect, it will limit services, increase waiting lists, create inequities, increase unemployment with unintended consequences for the social welfare system. At a practical level, the rationing of services will inevitably lead to a sicker population now and for many years to come. The rationing of services will, let's be honest, affect the poorest and most vulnerable in our society, who will simply not have the means to pay for the essential health services. When this crisis passes, and one thing is sure that it will pass, we will still need a fully functioning public health service, which meets the needs of a hopefully healthy population, and not a population that has suffered the ill effects of rationing. What does this say about us as a society? How do we want a society to view health? Are we committed to a public service that delivers quality patient care to all, irrespective of their ability to pay? Or are we moving towards a system where health is treated as a commodity that is driven by market forces and where only money talks? There has never been an honest debate in this country about the privatisation by stealth of the secondary care system and the consequent downgrading of services. Principles of social justice, social solidarity and equity are quite simply not best served by the unfettered development of private hospitals. Traditionally, there has always been a place for private medicine in Ireland, but with a political philosophy that has actively encouraged the growth in this area, the patients of this country have not been well served. Taxes have been foregone to provide tax breaks to developers who understandably are in the business for purely commercial reasons. I appeal to the powers that be to end the co-location project which was ill-conceived from the beginning and was never going to deliver on the principle of giving care based on medical need as opposed to the ability to pay. Let us use this time to have an honest and open debate about what, as a society, we want for future generations. In 2004, when the HSE was established, all stakeholders, including the IMO, had looked forward to a period of cooperation, partnership and reform. Disappointingly, what has come to pass has been the polar opposite of our hopes and aspirations, and the Health Service currently has a staff who, while striving to do their best, are disillusioned and demoralised. One of the main issues, as I see it, is that the HSE's plans for change and reform have never included the basic principle that for any change to be successful, you must bring the people along with you. If the HSE seeks to railroad changes in opposition to the doctors working in the public system, then their legacy will be one of failure. I am not just speaking in relation to doctors here, but it is now almost universally accepted that there is little or no confidence in the HSE's ability to deliver a first-class health service, either in good economic times or bad. The HSE has continued to ignore the stakeholders in the health service. I have warned previously that it would be wise for the HSE to positively engage with all the stakeholders and to pay heed to the breadth of expertise, experience and knowledge that exists throughout the health service. Sadly, our voice, like many others, fell on deaf ears and the inevitable results have come to pass. The HSE management style has the basic philosophy that those working in the health service will be browbeaten into accepting all decisions handed down from on high. This autocratic corporate culture must change, and it must change now. Such an attitude, quite simply, has no place in modern management and flies in the face of every principle of partnership. The Health Forum is a classic example of a good idea addled by the action and inaction of the HSE. The Health Forum was originally intended to achieve a change in work practices, to open up bottlenecks in the system, to provide the opportunity for all stakeholders to work through problems and to openly discuss solutions. However, the HSE has used the forum to tell the unions what unilateral action it tends to take next. It is said that every crisis offers an opportunity, and I call on the HSE to seize the opportunities that lie ahead. I call on the HSE to re-engage through the Health Forum in the manner for which it was established. I call on the HSE to stop treating staff as enemies and instead to work in partnership with them, but most importantly to listen. In the current economic crisis, we can work with the HSE in delivering economies, but only when we have a true picture of what the actual savings will have to be made. In February last, we were told that the HSE deficit would be in the order of 1.2 billion for the year, and it was on this basis that they were preparing their programme of cutbacks. By the 12th of March, the deficit was revised to 480 million, and more recently there is confusion with the suggestions that the deficit is now in the region of 540 million. Does anyone know the correct figure? Even if we take the figure of 540 million and accept the need for corrective financial measures, why is it that doctors, who form 8% of the health service workforce, are being told that they will provide more than half of the total cuts? Cutbacks which are not properly thought through and which, at the stroke of a pen, slash hospital budgets and cut funding at primary care level do not carry with them any assessment of the risks to the community as a whole or to individual patients. Nor have they given any consideration to the safe environment for those delivering vital services. Doctors in Ireland do a good and valuable job and want to be in a position to continue to do that job. Surveys of patients' contact with doctors are positive. Short-term gains will never deliver long-term solutions. Doctors are responsible, qualified professional individuals who are accountable at each stage of their training and career. The IMO is a professional body which shows leadership and responsibility and is accountable to its members. It is with regret that we have seen that the HSE is not transparent and is accountable to no one, and it shows.